I want to start with you, Ali. Two of the main goals of health systems anywhere are access and cost, increasing access and reducing cost. How can AI help in this regard?
Thank you very much for that, Dr. Morsy. The issue with access and cost, look, access today is significantly less issue than it used to be. We talked about Rwanda. We now deliver healthcare to almost the entire population of Rwanda if they wish to have it. And there are many are in remote villages with difficulty to access. We don't need to put a clinic and take a doctor to that village. As long as people have a mobile phone, and in Rwanda is a feature phone, they can contact us, right? The problem is there is no accessibility without affordability. The issue of affordability of healthcare, it's all about cost of human beings on one end and cost of dealing with a problem too late on the other end. And on both of those, AI have a very huge role to play. Because on both of those, on one hand, if the artificial intelligence can deal with the questions I have and do so well, then frankly, it gets me a long way. So here is what we do. You wake up, you have a symptom. You want to know what's the diagnosis for that symptom. And actually, diagnosis is a matter of intellectual curiosity in a way. What you really need is what is the treatment. And as you know, it takes 17 years for best treatment to become common treatment. So how do you know that even when you talk to a doctor, the treatment they give you is the state-of-the-art treatment for the problem you have? Then when you have the treatment, how do you kind of make sure that that treatment it's applied and correctly and it's followed? And then sometimes, unfortunately, you don't recover. You have a chronic condition you have to manage for life. Everything I just described is sick care. There's no reason why we can't do some of this with AI. So 40% of our users, when they use our AI, they basically get to an answer that satisfies them and they don't need to come and talk to our doctors. And in a capitated model, that is a significant cost saving for us. It's also a significant matter of satisfaction for them. When they do come to our doctors, the AI has asked them all the questions necessary that the doctor needs in the first instance. So we don't need to waste the time of the doctor asking those questions over and over again. So we can now save a few minutes, usually about 30% of the time of the consultations on that. And then the machine can also help to write the notes, which doctors spend anything between 20 to 40% of their time writing. So if you just take that 40 plus 30 plus the 20 to 30 at the end and compound it, you get to about 70% cost saving. And that's how we can manage to deliver end-to-end primary care at a capitated fee of, say, $100 or so in United Kingdom for an entire year, or in Rwanda for $1. So it helps. Professor Morsy, you said something very important, and I think I want to emphasize that, because on one hand, I said all the good things AI can do, but on the other hand, I need to emphasize how much in its infancy it is today. And the only people who really hype the AI often are the journalists. Sometimes about 2 years ago, this is absolutely true story. 2 years ago, we came out with a paper at an event. And in the event, we showed that under strictest conditions, we managed to get our AI to perform our par with primary care physicians, but under the strictest conditions and only for a set of primary care diseases, right? There was a journalist from the Forbes, and she went in and wrote that this machine just beat AI, beat doctors in AI, right? Completely, almost a massive exaggeration and hype on what we said, right? The very same journalist, 6 months later, wrote another article accusing us of hyping our AI, right? The very same, right? So what you see is that there is this bit about something becomes fashionable. You could just see it in the share price of Amazon. If you ever go and look at the share price of Amazon from when it went public in 99 or whenever it was, you see this massive hike in valuation because of what you just called hype. Then the reality fits. And actually, if you follow what Amazon has stated, they never really pushed that hype, right? Then the reality of how hard it is came in. And the share price of Amazon almost did nothing from 2001 to 2007 and 8. And then around 2008, the promises started delivering, and they started growing really fast to a point that if you invested in Amazon in 2008, today you'll be a very rich person, right? Yes. So, but it took them a very long time of delivering the hype that wasn't created by them. We should be really careful, very careful, to constantly remind people how much it's in its infancy AI is on one hand, but on the other hand, equally, how big its promise is going to be eventually. And to get there, we need to invest today, we need to work today, because those who are not participating in this revolution will be fundamentally left behind. The non-AI model of healthcare in a number of years from now will be a non-existent model of healthcare.
Yes, and that's a very balanced approach. Thank you very much for the insights, Ali.